Thank you so much for joining us on this episode of Family Matters. Once again, I'm Purity Museo, and tonight we are discussing matters vaccines in the country. And joining me is the head of the Vaccines and Immunization program in the country, Dr. Tabu, to take us through this discussion at Purity_Museo and at KBC Channel 1 News. Thank you so much for coming, Dr. Tabu.
Asante.
You know, I saw you getting the vaccine on Friday, and I was saying, okay, I hope my guest will be fine by the time it's Sunday.
I am all fine.
Yes.
As you can see. Thank you for having me, Purity.
There are some of the things that the nurse was telling you, maybe some of the side effects that you may experience. Did you experience any side effects after the jab?
Very mild. For instance, I still feel some slight numbness where I got the injection from. A bit expected. That's what the nurse took me through. That's what I also do know. I expected to feel a bit of a slight raise in temperature. I did not feel that. Other things I expected to feel was a bit of fatigue, tiredness, a bit of body pains, a bit of headache, lightheadedness. I did not feel any of that. I am okay to be here. I've driven myself here. So I'm grateful for that. And
did the nurse maybe tell you after this number of days or hours you may experience these symptoms, or for now you can say you're out of quote-unquote danger?
Yes, absolutely. They, you know, we got through all of that process even as a doctor, so this was explained to me that I would get any of these symptoms either immediately or much later. It's about 3 days now. I haven't quite seen any of the symptoms. Yeah, so, but just like for every other vaccine, we continue watching out, monitoring in terms of how I feel, and they are continuously in touch with us. Yeah.
And the exercise began on Friday. Maybe you can bring us to speed on how many people you vaccinated so far, and what's the feedback from them? Are they reacting like you are?
Yeah, so I don't have the exact figure, but they're in their hundreds. Remember, we went into the weekend. We had the first center starting the vaccination, that was Kenyatta. We have the first numbers coming in on Friday, they're in their hundreds. But by and large, you expect most of the counties, the county referral hospitals rather, to come on board starting tomorrow, which is Monday. So we'll see a lot more people vaccinated because, as you're aware, every county has received their share of vaccines. Every county has been trained. Every county have the necessary requisite tools to be able to deploy the vaccines. So they're just waiting to roll and go. The ceremonial launches within the counties may follow soon after, a number of them Monday, tomorrow, a number Tuesday, or so forth. But they're ready to roll from tomorrow, and we'll see huge numbers coming in terms of people being vaccinated.
And allow me to stay with the symptoms, because that's what most Kenyans are afraid of. You said you're experiencing some numbness still. Do you have an idea when that is going to disappear?
Within this week, I anticipate that it goes off within the week, just like a normal injection. This is what I expect. Actually, it's not quite something I experience unless when I do touch, then I realize, okay, something happened there, but it's something that you easily ignore. It's not something that would limit my function. It's not something that will stop me from working. I've been able to attend to my routine duties.
Yeah.
Yeah.
And something else still related with the vaccine, maybe, Daktari, from what you've been able to gather from your research about this vaccine, what are some of the side effects? Apart from what you experienced now, what are some of the side effects that any Kenyan who is going to take the jab should look out for or should expect?
So the vaccine is safe and effective. By and large, we do not expect any major side effect. None have been reported so far in the studies that we've seen. But as you get the vaccine, just like other vaccines, we expect to have most of the side effects being mild. You'd have a discomfort or numbness at the place for injection. You may feel a bit of fever, temperature, maybe up to 37, 38 degrees centigrade, but largely because of the immune reaction to the vaccine, and it's a process that is expected. We may feel a bit of headache, a bit of lightheadedness, you may feel a bit of tiredness or fatigue, not very severe though. We're yet to report cases where people have been taken ill or debilitated because of this particular vaccine. However, because we have not seen it, is not an excuse for us to let our guard down. We continue monitoring, just like for the other vaccines. And again, just like all the other medicines, vaccines are not unique. They're not exempt from what is expected. Just like other medicines, vaccines also have some small side effects that are expected. Most of them are mild, though, and they would not require further follow-up or treatment. However, we keep on the watch and we keep following up our clients. Just to share the seriousness of the follow-up processes, unlike the other vaccines, we have a pre-registration process. So part of the pre-registration process is that we get all your details, including your contacts, phone number, residence, everything, and any comorbid conditions that would either allow us to give you or allow us not to give you the vaccine. So that is documented. That information is used to schedule your vaccine visit. So you given the vaccine, we observe you for probably half an hour before we let you go home. But that record remains with us to allow us to be able to follow you up and just see that you are okay. Because remember, the primary objective is for us to protect you from severe COVID disease and from possible death from COVID disease.
All right.
Thank you.
And let me take you back. Is it a painless exercise? Is the jab painful? How can you describe it?
No, you hardly feel it. You actually, it's over before you realize it. Yeah, you probably feel the numbness slightly after, but we probably psychologically, you probably would be psychologically traumatized by looking at the needle itself rather than by feling the needle itself.
Especially for those who fear injections.
Exactly, me included.
Me too.
Thank you.
Okay, so why AstraZeneca?
Yeah.
Why not Moderna, Johnson & Johnson, Pfizer vaccine?
Thank you. So Purity, from where we sit as a country in terms of considering the vaccine candidate or the vaccine choice for this country, we do not, first of all, exclude all the others, but we did prioritize the AstraZeneca vaccine. And this is because at the national level, the COVID-19 rollout task force determined that this is the vaccine that could be most efficiently delivered through the existing routine mechanisms. For example, it is a 10-dose vial. It means 10 doses in one vial. It takes less space. It is stored between temperatures of 2 to 8 degrees centigrade. So it fits within the storage requirements, just like the other vaccines. It requires minimal adjustments to the existing routine immunization mechanisms for us to then be able to deliver it for us. Lastly, it's one of the vaccines that's probably going to be produced by one of the biggest vaccine manufacturers. So as we move on, then the risks of stockouts, the risks of having supply challenges are much less for AstraZeneca than would be for the other vaccines that have a smaller production footprint. Yeah. And
this vaccine, we are just being told it's part of the COVAX facility. Maybe you can tell us how Kenya got into this, partnership with the WHO and UNICEF, and which other countries are there, just to, to ensure confidence, especially among Kenyans.
Yeah, so first of all, just to assure the confidence of Kenyans, it might look like this vaccine is coming through a COVAX facility, that we are being given this vaccine. I just want to share that, first of all, the COVAX facility is run by an organization called Gavi, Global Alliance for Vaccines and Immunization, Gavi the Alliance. Now, Gavi supports the countries of the world to access vaccines, new and vaccines that would otherwise not be available or affordable for the country. For example, through the Gavi mechanisms, we access the pneumococcal vaccine against pneumonia, we access the rotavirus vaccine, we access the inactivated polio vaccine, we access the vaccine against cervical cancer, we access the pentavalent vaccine and all of that. So the government gets to pay about 20% and Gavi pays about 80%. So when COVID-19 came, again, the countries of the world rallied together because at the time the vaccines are being developed, several candidates of the vaccine, and you're not too sure exactly which one would then be the most effective and which one would be less effective. So the Gavi COVAX facility really pulled together close to 200 countries. About 95 of those countries are self-financing, they're the developed countries, but about 92 of those economies are developing countries that then would need to be supported to access these vaccines. So this sets in motion then a sort of pooled mechanism or pooled procurement mechanism where together all these economies share the risks that would come through that pooled procurement mechanism, but also they're able to access all the benefits due to them. This would not happen if a country went on its own, because then assume you went on your own, you bank your hopes on a vaccine candidate which perhaps later on turns out not to be effective, then you find you've lost it all. So that pooled procurement process gives a win-win situation for all. So we end up with a situation then that we have all the successful vaccine candidates being considered under this umbrella. Then countries make a sort of choice in terms of what would be their priority vaccine choices, just like we did make that kind of decision. Then Gavi maps these available vaccines to these 190 countries, almost 200 countries in terms of availability, and therefore purposes to be able to deliver these vaccines. So in that context, then you can see that the global mechanism is allowing at least each country to access a number of vaccines, a few million doses of vaccines at a particular time, point in time, just trying to assure equity among all of these countries, a situation that would not have happened if each country was running on its own. Many poor countries would really be left behind and would not have been able to stop the pandemic.
Right. And Kenya is among the countries in Africa that received the highest number of doses of the vaccine. And we know that Kenya is not a country with the highest, is not among the countries with the highest number of COVID-19 cases. Is there a criteria that was being used in sharing this, vaccine?
Yeah, so largely Kenya may not have the highest number of COVID-19 cases because largely the government has been very instrumental in putting in place the health measures that really mitigate against the COVID-19 pandemic. But looking at the population, Kenya is among the top 10 populous countries in Africa. The COVID-19 vaccines allocation through the Gavi COVAX facility is really targeted on a proportion of the population. So the objective is really to have at least 20% of the country's population access the COVID-19 vaccines. So that is really the criteria, a lot more beyond the capacity of the country to be able to manage these vaccines, the readiness of the country to be able to manage these vaccines, and the population of people that have the specific risk criteria that we're looking at, the comorbid conditions, chronic conditions that we talk about. So we may not have a high burden of COVID-19 disease, but perhaps we have a high population and we have a high numbers population of people that have these chronic conditions that need to be reached.
And transporting such vaccines could be delicate because they're supposed to be stored under really, really low temperatures. What sort of preparations did the country have to ensure there is no compromise between India and now landing into JKIA and finally transporting them to Kitengela?
Thank you. So we for a long time had to go through this process of mapping out our supply chain. Mapping out our supply chain all the way from the manufacturer until the vaccines land within the airport. Within the airport, if you realize, Purity, the vaccines did not go into some go-down to be stored awaiting clearance. They were moved right away from the flight to the vaccine depot in Kitengela. And as they were not moved in an ordinary truck. They were moved in refrigerated truck that are calibrated to maintain the temperatures between 2 to 8 degrees centigrade. As I speak today, last Wednesday, we dispatched the vaccines to the counties through the regional depots. Again, refrigerated trucks that have real-time temperature monitoring, maintaining the vaccines between 2 to 8 degrees centigrade were used. So we mapped all these out ahead of arrival of the vaccines just to be able to be sure that we deliver the best in terms of an efficacious and effective vaccine to our Kenyan people. As I speak today, the vaccines are held at the county level, the county vaccine depots. These depots, we're not taking anything to chance. These depots have real-time remote temperature monitoring devices that I can log on now and check what the temperature is of a depot in Mombasa or a depot in Kisumu, so that I don't even need to make a phone call or something. That is how stringent the monitoring is. Again, the movement has been streamlined and facilitated because the government gives the system gives an advance notice of arrival of the vaccine. So all the plans are laid out.
And so the 1,020,000 doses that we received on Tuesday, you're saying they are all safe?
They are all safe, ready to go. Ready to go.
So let's get to talk about the distribution of these doses. Maybe do you have a priority in terms of, because I know you have 9 regions and counties are have been affected differently by COVID-19.
Yes.
Nairobi is largely hit by the pandemic. So do you have a priority, or how are you going to do the distribution of the doses?
Yeah, so the distribution of the doses is based on the populations of the target groups that we purpose to reach. Remember that 3 key objectives around vaccinating against COVID within our country. The first objective is for us to assure the continuity of the very critical essential services within our economy, those that will assure the continued functioning of the economy. Number 2, the second objective would then be to reach those that are most vulnerable to death or severe disease from COVID-19. And then in the third instance, we seek to reach those individuals that are again still vulnerable, but in sort of like congregate settings, urban informal settlements and so forth, to achieve equity and be able then to break the transmission cycle, because then these are most likely crowded places where transmission happens very easily. So looking at the first category, then we have the frontline workers within these sectors of the economy. We have the populations mapped out. We have a fairly good idea about the prevalence of our chronic conditions around the country. So we have the proportions of populations mapped out by county, which then lead into deciding how many doses. That's for the second phase. In the third phase, again, we have a fairly good idea about where the urban informal settlements are, where the nomadic populations are, where the prisons and other congregate settings, care homes are. So we're very clear in terms of where the doses go. But we also do not know it all, so we're in constant engagement with the counties, refining those plans from time to time, just so that we are sure we don't miss out anyone else who deserves to be vaccinated.
And so let's get to learn about how the vaccine works against the virus. There are so many concerns on who should take, who should not take. If I have COVID-19 symptoms, should I take it? If I once got the infection, am I immune to the virus, or I can still take it? So how does the AstraZeneca vaccine work against the coronavirus?
Yeah, so thank you. The AstraZeneca vaccine is made from sort of genetically modified virus particles. So these do not have the capacity to cause disease, but they resemble the COVID-19 virus in a sense that when they are presented to the body, then the body is able to develop an immune response to them, which can then stays in place and can be used to fight a future COVID-19 infection should it then arise. So in this sense, the introduction of the vaccine in the body allows the body to develop its own defenses to be ready for any COVID-19 infection should it arise. This does not mean that we will not get infected if you have been vaccinated. It means that your body will be, your immune system will be strong enough to be able to resist this infection should it come into the body. Should it come into your body. Now, in terms of the vaccine itself, every individual above 18 years can be able to take this particular vaccine, except those individuals that perhaps would have a severe reaction to the very initial dose of the vaccine, for instance. Other people that we may exclude are people maybe who have a very severe infection with the COVID-19 itself. You want them to be able to recover and give them about 2 weeks before then you can vaccinate them. Or an individual who is very sick, who has an illness severe enough to warrant admission at that particular point in time, you want to be able to manage their illness so that after that, then you can be able to give them the vaccine. But otherwise, for all other people, you're able to give the vaccine. The only other precaution I'd like to give is that the vaccine, there's not so much information available as to how the vaccine affects the unborn baby. So we want in as much as possible to avoid vaccinating pregnant women unless it is determined in such a way that the benefits of vaccinating such an individual, a pregnant woman, far outweigh the perceived risks of vaccinating this particular individual. So those are the categories we are cautious about. But anyone who is over 18 and fits within the categories are prescribed as a Ministry of Health is eligible then for vaccination.
Yes, and that brings me to the next question on the dosage of this vaccine. I understand as Dr. Tabu, you are set to get another jab.
Yes,
you know, so let's say, does it mean it will protect you for these 8 weeks and then you need to get a second one? And my question is, what does this second jab mean? Does it mean that you're not protected for life against COVID-19?
So you consider the first jab as one that primes your immune system, primes your body. And the second jab works to boost that immunity that has, you know, to boost the immune response for your body, because the first one sort of like primes your body. Your body immune system is sort of like in a state of readiness. So the second jab works to sort of like boost this particular response and make it more effective for it to fight disease. So we do anticipate that for the vaccine to be effective, you need to at least get 2 doses. Now these 2 doses the second one comes at least 8 weeks after the first dose, or any time after that. In cases where there are delays. Yes,
let's revisit the issue of who should and who should not take the jab. Please make it clear, Dr. so that when it's presented to you or you're there, let's say you are a health worker and you have some of these issues that you are going to talk about, then you don't have to waste your time in going there. Yes.
So just to be clear, you will not take the vaccine, say a second dose of the COVID-19 vaccine, if you have had a severe reaction to the first dose of the vaccine. That is very clear. Number 2, you will not take the COVID-19 vaccine if you're having a severe attack of the COVID-19 infection. Not if you're asymptomatic, if you're having a severe infection attack confirmed by PCR of the COVID-19 infection. You will not take the vaccine if you are severely ill, illness severe enough for it to warrant your admission. You want to wait until you're better. And lastly, we need to be cautious in vaccinating pregnant women. We need to be able to assess that the benefits in vaccinating that pregnant woman far outweigh the risks. For example, if this pregnant woman has chronic liver disease, this pregnant woman has a chronic lung disease, this pregnant woman has perhaps cancer or some other disease that place them at a very high risk of severe disease or death from COVID-19, you perhaps want to consider vaccinating them. But in the absence of that, you perhaps want to wait and vaccinate later.
Understood. But what you said that the second jab is for boosting now your body to fight. So if you have reacted in the first jab and you're not getting the second jab, what does that mean to you in the fight against COVID-19? Does it mean that now the jab is not working for you and therefore you should be ready for maybe severe reactions in case of an infection? No,
the reaction does not come from the active ingredients of the vaccine itself. It comes from most of the time, the components of the vaccine itself. So having gotten the first dose of the vaccine and missing out on the second dose of the vaccine, it just means you are not optimally protected. The protection from COVID-19 infection is not as optimal as someone who has received their 2 doses. But remember, at that particular point in time, if you have this severe reaction in the first instance, it means that the second time you might have an equally or more severe reaction. Now, remember, we seek to protect the healthy from COVID-19. In vaccinating, we seek to do no harm as we seek to protect you. So that is why we'll withhold the second dose
yes.
in that instance.
Talking about if you have symptoms of COVID-19, you cannot be vaccinated. So if you
Not symptoms, Purity. Even if you have symptoms, you can be vaccinated. But you will not be vaccinated if you have confirmed COVID-19 infection with a severe cause, the severe infection. You have very strong symptoms, severe
So
symptoms.
asymptomatic patient can be?
Yes, you can be vaccinated.
It's possible?
Yes.
And let's say if I had COVID and recovered, am I still eligible to take the vaccine?
Yes. If you had COVID and recovered, you will still benefit from the vaccine. And speaking of COVID infection and vaccination, it is not a requirement, it's not a prerequisite rather for us to be able to test you for your COVID status, for us to be able to give you the vaccine, for instance. Yes. Just like for pregnancy, it is not a requirement for us to be able to test you for pregnancy before we can give you the COVID vaccine. Yes.
Okay. So now let's talk about now the recommend. Okay, we talked about that, and then the safety as well. But now we have the variant that the Minister of Health said that could be circulating, in the country. So can the vaccine, take care of this new variant? Because we've had other vaccines in the world that are not working. And there was a time actually South Africa had raised concerns that the AstraZeneca vaccine is not working against the variant that was found in SA.
Yeah, so thank you. If we step back from the new variant, you will realize that the biggest burden of disease within the country has been the existing variant. So if we do not introduce the vaccine to take care of the variant that has caused us more than 99.9% of the disease, then we would have failed. So by introducing this vaccine, would have saved a significant amount of disease burden and deaths. Number two, in terms of the new variant, as we come there, you do realize that yes, it has been introduced in the country, but it has not reached the level of community transmission. So as we move on vaccinating and protecting ourselves from the existing variant, remember the global community is also working to update, upgrade the vaccine to be able to respond to those needs. And it's not quite been predicted how far the new variant then would be able to spread. So again, it is a decision at country level that we're looking at the burden of disease of the existing variant and the new variant that is being able to come in. And as we move on with that again, just weighing in the new variant and the vaccine as it is, maybe it might be interesting to know that for you to protect yourself against COVID disease, it's not just about the vaccine alone. That the infection prevention measures and the health protocols that we need to be able to observe. So those apply for both the old variant and the new variant. The only variable here will be the vaccine, for which then we'll be able to transition based on the epidemiology of the new variant as it unfolds.
All right, and thank you for that clarification. There have been a lot of concerns especially on the safety of the vaccine, and most Kenyans are saying, why are we starting with the healthcare workers? Why are the leaders? I'm glad you led by example, but they were asking why is your department not even recommending other, especially the leaders, to take, like we saw in other countries, especially even in Africa? Are we having maybe not a shortage of the doses that we cannot prioritize the leadership of this country?
Yeah, so the leadership of this country are priority. But again, in terms of who comes first is a country level decision. It's not a prescription from somewhere else. It's discussions around, remember we have a national COVID-19 vaccine introduction task force. So it's a discussion that takes place there. So for us as a country, we have mapped out the priorities in terms of how we want to approach it. We look at the sectors of the economy that we want to ensure they continue functioning. So we start with those and we're saying, look, the health workers need to be protected first. The school system is now opened. We need to be able to protect our teachers. We have curfews and the curfew on and other health protocols that need to be enforced. So we need to protect our uniformed forces. But then within this context, our leaders will also come in much later to be able, you know, perhaps to assist with the coordination and all of that, providing overall leadership. But according to the task force, again, they did not quite place that as fast. That's why you're seeing the health workers get a fast go. And I'm very glad the leadership of this country really did support the task force on that and agreed to that. And like you have seen, you've not seen the politicians, for example, have a fast go at receiving the vaccine, having graciously stepped aside to say, look, you are the foot soldiers, you are the frontline workers, please get protected so that the essential segments of the economy can continue functioning.
All right. And what's the target, especially from your end, your department? How many people are you targeting to vaccinate at what particular time? And of course, because we have at least 1 million doses of the vaccine, are they all distributed, and do we expect another batch of the vaccine once, you know, we explore what we have now? Yeah,
so Purity, we do expect to receive at least 4 million doses of the vaccine before June.
Okay.
So we anticipate that by June we would have vaccinated and gone beyond our first phase target of 1.25 million Kenyans that we anticipated to reach. There's 1.02 million doses that we did receive last week was really the first shipment. We expect in the next few weeks the subsequent shipments to follow. We have released about half of that shipment to the counties to begin the first phase of vaccination. But of course, based on the consumption and based on the target groups that we need to reach, we'll be releasing the subsequent ones as we move along to be able to be sure that we reach everyone. Remember, of utmost importance for us as a program is that we achieve equity in the distribution of the vaccines, is that the vaccines get to where they are needed most. So for instance, you don't want to send the vaccines to one end of the country, yet most of the people in the target age group are in the other end of the country. So we have this mapped out and we are monitoring the consumption, utilization, really not consumption, as we move along.
All right, and Daktari, allow me to ask you this particular question, because there are a lot of concerns going around for Kenyans.
Yes.
And for the 4 category groups that you've been able to identify as a ministry, the doses that we have, are they enough for them, or they'll have to wait until June before we get another batch of the vaccine?
The doses are enough for them, but like I said, the next shipment will not wait for June. By June, they'll have received all the 4 million. The next shipment will be towards the end of this month again. So you can imagine that we'll be able to cover all of them and perhaps even be able to move into the second phase of the vaccination earlier than anticipated.
Okay. Allow me to take a few questions.
Thank you.
Someone is asking, my daughter who is 6 years old is allergic to certain foods. Now, is it safe to get a vaccine for her?
Yeah, remember, we are not vaccinating individuals who are below 18 years of age. So, Madam, your daughter who is 6 years in the current instance is not eligible for vaccination. Thank you.
Because is a child?
They're under 18 years.
Okay, under 18 years, right. And then George Kirimi is asking, who is watching from Meru, are we paying for the vaccine or it's free?
We are not paying for the vaccine. The government has taken measures to ensure that it avails the vaccine to Kenyans at no cost, and that the finances of Kenyans will not be a barrier to them accessing the vaccine whatsoever. Yeah.
Okay. There's someone else, Kelvin Munene, who is saying, how sure are we that the vaccine is effective?
Yeah, the vaccine is effective because we have had several trials around it. It has, for us, of most importance is that this is the only vaccine that was very initially tried out, had the clinical trials done within the country. And it has shown efficacy levels of between 70 to 90%. And just to note, some of the vaccines that we use in the routine immunization program have much lower efficacy levels, but they have been successful in terms of controlling disease. I'll give you an example. The rotavirus vaccine is just about 55% efficacious against rotavirus disease. But since the introduction of the rotavirus vaccine in about 2015, we have seen more than 2 times a fall in the burden of rotavirus disease. So even when you have a 70 to 90% window of efficacy for the AstraZeneca COVID-19 vaccine, we will still be able to see tremendous reduction in the burden of COVID-19 disease from that particular vaccine.
Okay. Lawrence is asking, how long does a vaccinated person take to show up the side effects?
It varies. First of all, the side effects are undesirable, but they happen invariably from person to person. Almost 50% of the people exhibit those very mild symptoms I talked about, just some mild numbness, some slight rise in temperature, a bit of fatigue. More than about the other half will not exhibit anything. Most of those symptoms are almost immediate in the 1 week after following these. But then again, as we monitor the side effects, we don't put a timeline to them. We want to encourage Kenyans to report anything they feel or imagine might be related to the vaccine that they have received, for it to be investigated and a determination made adequately.
Okay. Yeah. I think you had answered about whether it's free or not. Carol is asking, will the vaccine protect me 100%?
The vaccine will not protect you 100%. Remember, the vaccine will protect you from severe COVID-19 disease and reduce the risk of death from COVID-19 disease. You may get the disease, but your infection will not be severe. Number 2, like you had, the efficacy of the vaccine is about 70 to 90%. And number 3, given all these, even when you're vaccinated, remember you can still be able to get the infection, and perhaps you can be able to even transmit. So we still need to continue observing the health protocols. Physical distancing, hand washing, masking, and many other protocols that are in place. We still would need to continue with them, even in the context of vaccination.
And as we wind up, Daktari, vaccines take really long time before they are ready, up to 10 years.
Yes.
But Kenya is, not even Kenya, but let me give an example of Kenya. We are getting the vaccine. We're not even 1 year into the pandemic. We are marking our anniversary next week, but here we are, we've started the exercise. Is this something that should worry Kenyans? Are you confident that the vaccines, not just the AstraZeneca, but the vaccines being produced around the world as an expert, are safe for use? And I may ask, have we seen such instances where vaccines are readily available as soon as possible? Is it because it's a pandemic? Why so soon? And safety is coming. The safety questions are coming because of the,
So thank you. I want to highlight a few things. This vaccination program is not like the other routine immunization programs that we have rolled out. This is really a national emergency response. Perhaps I should say a global emergency response, because it is happening simultaneously in all of the countries of the world. Secondly, so it is being done in that context. So yes, this expedited development of the vaccines is linked to this being a global emergency, the pandemic. Number 2, the vaccines are safe. This is to say that as these vaccines have been developed, no steps in the development or the testing of this vaccine has been skipped. Rather, unlike the other vaccines where they're deployed in a routine mechanism and the steps to developing of these vaccines are taken in sequence. So you finish these, then you monitor, then you go into that and go into that. For the COVID-19 vaccines, all care has been taken to assure safety, but most of the steps have been taken simultaneously. So then we see a quick turnaround. Third, like I'd like to share with my fellow Kenyans, COVID-19 is real. All of us do know at least one person who has come down with COVID-19 or one person who has died due to COVID-19. For how long would we be waiting, or for how many people would it take to lose for us to be able to say now, yes, let's now accept this vaccine? You can see what is happening to our neighbors. It's not an interesting kind of scenario. So the safety issues are there. we don't abdicate our responsibilities. Just like for the routine immunization program, we have an independent entity that is in place to continuously monitor the safety of these vaccines.
Okay,
we have the Pharmacy and Poisons Board that is in place to independently evaluate, license, and allow the deployment of these particular vaccines. So the disease is real. Let's be able to weigh the risks against the benefits and be able to work towards taking off the burden.
I think that should be the parting shot. The disease is real because we are winding up. The short time is not on our side.
COVID is real. It takes me and you to prevent it. It takes me and you to protect ourselves. For as long as I'm vaccinated, you are not vaccinated, we are not safe. We all need to be vaccinated. And when
and if the time comes, take the vaccine.
Take the vaccine.
Like you did.
Like I did.
Thank you so much, Dr. Collins Tabu, for your time. We'll continue to interact as you continue to roll out this program in the country.
Thank you, Purity.
Okay, and thank you for watching. Thank you for your feedback. This is Family Matters Show. My name is Purity Museo. Baron Abuli has been assigned language interpreter tonight. Good night and God bless.